Hi, everyone. Thank you for joining us for Remember the Girls' fifth webinar of our 2021 webinar series. Remember the Girls is a nonprofit organization dedicated to supporting and advocating for female carriers and patients of X-linked disorders, a group often overlooked by the medical profession. I'm Taylor Kane, the founder and executive director of Remember the Girls and the moderator for today's event. The topic of this webinar is how and when to talk to your daughter about her carrier status. We'd like to thank the sponsors of our 2021 webinar series, Horizon Therapeutics, Bluebird Bio, Ultragenyx Pharmaceutical, and Sanofi Genzyme. Today, we are joined by Remember the Girls members, Michelle, Franny, Jesse, and Anna, who will be talking about their personal experiences discussing carrier status with their daughters. After their presentation, I will be passing the mic to Dr. Susan Waisbrun, who will introduce herself and speak from a psychological perspective about how mothers can navigate this experience with their daughters. So we'll just jump right in and get started. So first, we're going to have Jesse and Anna. So Jesse is the mother, Anna is her daughter, and so they're both going to be speaking about what this experience was like for them a couple of years back. So let's kick things off.
Thank you for having us. My son, Jack, Anna's brother, Jack, was diagnosed with adrenoleukodystrophy 14 years ago, almost to the day. And at that time, I was tested and they discovered that I had the gene as well as my mother. We were told at that time that carriers of ALD needn't worry except having children, that we would not develop symptoms. So the fact that our only other child was a daughter, they said no need to worry until she was ready to have children. As the years went on and I educated myself a bit more about ALD, I realized that we're more than just carriers often, that many of us do develop symptoms as we get older. And I was increasingly concerned about knowing whether or not Anna, in fact, had the mutation. But my husband and I decided that it should come from her. She wasn't going to have children at 6, 7, 8 years old. And we really wanted to wait until she was ready to hear the news. When Jack was diagnosed, Anna was only 6 years old. But that was a real pivotal moment in her life. And she's now pre-med at Hopkins, looking at medical schools. It really kind of put her in that direction. And when she was about 14, she asked, we kind of assumed she had the gene, but she finally asked whether or not she was a carrier or had ALD. And so at that point, we called Columbia Presbyterian, where Jack had had his transplant, and spoke with the geneticist there that reiterated what the doctors had told us years before, that Anna shouldn't really worry about knowing until she was over 18. I believe they had to go through an ethics board in order to do the testing beforehand. But once my daughter asked for the test to be done, I was determined. So I said, I don't care what you do. We just want to go in there and have her tested. They were wonderful. They not only agreed to do it, but we went together, right?
Yes.
Do you want to share a little bit about that meeting?
Yeah, I mean, we went together to New York. We made a fun girls' day out of it, and spoke to the genetic counselor for a really long time. It was, I think, well, it was my first experience with a geneticist and a genetic counselor, and learning all of that from them and having an appointment with them. I guess you worked with them when you were tested, but I don't remember that. But they were super. I mean, I learned so much information. I've also always been really sciencey and interested in ALD and everything. So it might have been just for because I was asking a lot of questions, but we spoke for like an hour with the genetic counselor, then met the geneticist herself. They took my blood sample and said, they would call us in a few weeks or whatever the time frame was. Then I remember getting she got a phone call. I think we were like at the grocery store or something.
I was at World Market
Yes.
when they called.
And she started acting super weird towards me. She gave me like a weird hug. She was like teared. I didn't understand why. I didn't know what phone call she had just received. But she was in like a very good mood, but kind of strange. And then she told me later that the call she had gotten was that I am not a carrier for ALD. So the results were negative for the mutation. And that was kind of the whole experience. I personally was always just, again, because I'm so interested in science and always like love any excuse to kind of explain ALD to people and talk about it, just like my nerdy self. I had a lot of conversations, even just in high school, where people would naturally, I would explain ALD, explain the fact it's X-linked. And, we learned in like standard bio in high school that X-linked disorders only affect boys. So a lot of people would ask like, oh, are you a carrier? They would just ask, they would ask if I had it, and I never knew. And I think that was the main reason why I was curious. I wasn't necessarily fearful yet, just because generally the symptoms, don't start super young anyway, but I wasn't really fearful, but I was just curious, and enough people had asked that I was like, I guess I want that information. But obviously that's a personal thing. Some people might want to wait longer, but it was a good experience. Great mom here.
Yeah, really great.
Anna, how did you feel getting that negative test result?
I think at the time I didn't necessarily appreciate it for what it was so much. I think it was more so like, now I have an answer, and I don't know how sad I would have been if it were positive. Honestly, I don't know, she was much more like emotionally invested in the results. I was more so like, I would just like to know the answer. Now I feel, I think I appreciate it more, and there's more relief, seeing my grandma and my mom always have it in the back of their head when they see doctors that could be a factor in whatever health things are going on. I'm thankful that that's not the case for me. And also thankful that when I want to have kids, I won't have to pay for certain things, won't have to go through certain additional stressors. But at the time, as a 14-year-old, again, it was kind of just like, ooh, science, like genetic testing, let's see the answer. Yeah.
It was, on the other hand, I will never go to World Market again, because they were wondering why this woman was suddenly on the ground crying happy tears. But it was a huge relief for me. We went through so much with her brother, Jack, and we certainly weren't going to let ALD take another member of the family. So we're happy someday I'll have grandkids and she can do it the easy way.
Right. Well, thank you both so much for sharing. I love, hearing more about your story always, and what the experience was like for you. And I think so many of us can relate, where you've had doctors say, oh, your daughter won't have to worry about it till she's about to have kids, and we know for many X-linked diseases that that's not really the case. And there's a lot of considerations that we have to make, and, choices that we have to make, even when we are, in our teenage years and going into relationships. So, that's great that Anna was able to get that testing at that time and find out that she was not a carrier.
And it would have provided us the opportunity to prepare, with prepared to pay for college and med school. We would have prepared for her to have children in a more complicated, expensive way, but she would have had them. Knowledge is power with these diseases, for sure.
100%. Well, thank you both so much. Now we'll have Michelle introduce herself and share what her experience was like.
Hello, everyone. I'm Michelle. I'm Vice President for Remember the Girls. I'm also CEO for the Arscog Foundation. I have 3 children. My youngest is a little girl. Well, she's not a little girl anymore. She'll always be my baby, Zara. And the first time it came up for us was when, well, for me, sorry, I'll go to the beginning. My son was diagnosed 23 years ago with Arscog syndrome. And consequently, I had 2 other children following on from Zara, my middle son and then Zara. So they were following each other, 1, 2, and 3. When it came up that maybe I was a carrier, first of all, was quite late on, because 23 years ago, they didn't know very much about the syndrome. And so it was quite late on. And what happened was we didn't receive a diagnosis for my eldest son, Jordan, until he was about 5 years old. And that took a really long time to get there. And during that time, we'd found out that my brothers had the syndrome and that my mum must have passed the gene on to me. So knowing nothing about this disease and never having any kind of anything in our family, it was such a difficult period. I found it very hard. I was deciding that I was not going to tell Zara while she was a child. For me, it was, I didn't want her to be worried or frightened, and I wanted her to live a life, really, so that she didn't feel, didn't feel worried about it, or she didn't want, which it was open, she could ask me questions. But my belief for young people is that up until at least the age of 11, it's really about them being a child, enjoying life, and, all the experiences that comes with. From the age of 11 to 15, it was about school and identity and puberty and friendships. And these things were really important to me, that I allowed her to just be herself. So I chose not to tell her. And the other thing that supported that was I'd lost my mum. And so I had nobody else really that supported me to support my children. To go through this, and most importantly, to support my daughter should she have any questions. So I waited. And it was only the other day I asked her, I said, do you remember when I told you? And she said, I think I was older, I was about 16. And I said, and what did you think of that? Do you think I should have told you earlier? And she said, no, I wouldn't have wanted to know. So I'm glad that I did it that way. We didn't have the conversation again from the age of 16 until 2019, when I had to talk to her about pre-implementation diagnosis. Zara was sitting in a room. We were discussing her treatment. Chemotherapy was due to start in the January, and it was December. She just had surgery, and I had 4 weeks to save her eggs so that I could prepare her, and so we had the conversation, and it was a deep conversation. I'm a really emotional mother. When I say emotional, I'm not gushy, but I'm all over my children. It's so important to me, the way they grow, the way they think, how they feel, my impact and everything I do. And so I wanted her to talk about this so that she felt free to make whatever decision was right for her. And so we saved Zara's eggs. We were successful. We saved 8 eggs. And afterwards, she said to me, I'm definitely going to have the screening, Mum. I don't want to have a child with Arscog syndrome. I felt like the world stopped, because it was so important that she could come to me and say that. And I felt, you're never sure, are you, really, as a parent, that you're getting everything right. And so I felt so happy that I'd done it in a way that she felt she could talk to me about this, and even more so say to me, I'm not going to have children with this condition, Mum. I want my children to be free of it. So I felt very, very happy and that was the most important thing to me, that she felt good, that she felt confident, and she's bullshit. She speaks her mind. She tells me how she feels, but she's a beautiful soul. And so I feel, as I'm going into my 50s in a few years, I feel that it's very important that I've finally made peace with myself about it, because it was quite a hard journey. I found it very, very difficult, raising a child with a rare disease and having two other children that had different ideas. So that was really where it was for me, and how it worked with Zara.
Thank you so much, Michelle. That was incredibly powerful, to hear more about what the experience was like for you. And I know you and Zara, like Anna and Jesse, are also like this, and you both also look like twins as well in the pictures that I've seen of you two together. But yeah,
She's
thank
much
you so
better
much
looking.
for sharing. Yeah, thank you so much for sharing that.
You're welcome.
All right, so now we will have Franny discuss what her experience was like. Also, to all of our viewers, if you have any questions for our speakers, our member speakers, or when we have Dr. Waisbrand, you can just send them in the chat whenever they come up, and we'll address them at the end of the webinar. All right, Franny, passing the mic to you.
Thank you, Taylor. So I'm Franny Broussard Denenberg, and I was diagnosed with ALD almost exactly 3 years ago, after my mom and one of my adult brothers were also diagnosed. And, you know, we tested our children at the time. My daughter was 4 and my son was 21 months old. And we were just sort of in this adrenaline, just kind of running on autopilot. And it never really occurred to us, to not to test them. Once I was confirmed having it, we went ahead and just tested both of my children, both of the children at the same time. We didn't tell her right away, but every day I wanted to tell her. And I know she was only 4, but she is extraordinarily perceptive and sharp. And I truly felt that she would be able to digest and understand the bits that we would give her, in age appropriate ways. And so it wasn't so much that we told her as she asked us. I testified before the Texas legislature in support of newborn screening for Texas, and my family couldn't come. And so later we all watched it together, and it seemed appropriate for us all to watch, but she, while watching, picked up on the fact that I said, my children with ALD. And she instantly said, why did you say children? Why didn't you just say child? I thought Oliver. And so, we explained to her, we explained it in a very, I feel like appropriate way. We talked about genes and what their function is, and, what ABCD1 gene is, and how ours doesn't work properly. And I will tell you, the very first thing she said to me after we explained all this was, why didn't you tell me when we went for those blood tests? And so, I told her she was sharp. Like she was not happy that we had waited a few months. But, I was so relieved that she knew. And even though it didn't happen exactly the way we probably would have done it, we would have told her young. I mean, we weren't going to wait much longer. I had already read some articles about how to go about it and what would be appropriate. We probably would have involved a counselor, but I honestly wouldn't change a thing, because for our family, this has been, it's worked and it's been great. And she and I have had some of the most poignant conversations. I could truly tell you anecdotes and quotes from her all day long. I gave a presentation yesterday to a biotech company, and I think she was the star of the speech, really. Anna, like you, her questions are always really science-based. She wants to talk about genetics, and she's asked about clinical trials and how they work, and about medicine. And it's just, it's been amazing to see her in this role. You know, the other day they had at school, it was a fact finding day, and each child had to bring a fact to her class. And she wanted to bring a fact about jeans. She wanted to teach her class about jeans. And she had this cute little quote about jeans, not blue jeans. And it was just really special. We've involved her in everything, you know, our fundraising. You know, she was super instrumental in that and involved in the process. And, you know, I know that there are some of these things we could discuss jeans and we could discuss fundraising without her knowing her carrier status, but it just, you know, for us, it just seems, you know, kind of part and parcel, and just talk about it all together. You know, I obviously worry about the day that we'll have to discuss, you know, concerns about reproduction around, you know, with having an X-linked disorder, you know, what her options are. But I hope it will be as sort of organic and natural as all of our conversations have been to this point. I mean, we've talked about reproduction, you know, a little bit earlier than maybe we would have, because she wants, you know, at 5, she wanted to know how dad's genes got in her body when she only grew in mom's body. But, you know, like I said, it's been really organic and really natural. And, you know, my hope is that, having talked to her really early on too, that because we've been an open book as a family so far, and she's come to us with questions, you know, that one day when those questions get tougher and she has, you know, more concerns, that she'll feel comfortable coming to us and being able to talk about it. You know, a lot of the things, you know, a lot of our conversations are about ALD specifically sometimes, you know, whether it's Oliver's upcoming MRI or, you know, her grandmother's need for a scooter or a walker. You know, those things are not lost on her. I mean, she has, you know, brought it up that, you know, she gets the correlation that one day that could be something that affects her. But we always have this conversation about, you know, you can be sad and you can be scared and you can also be brave and strong. And so she sees me cry, and she sees, you know, if I'm short-tempered and you know, when I'm stressed, and we're honest with her about those things and why we're feeling that way about, you know, that scenario, that MRI or whatever it is. And so I hope that she can see, you know, the two sides, and it always be, Taylor, you've been, you're an inspiration to me, because I know you've known for a long time, and it's just been a part of you and who you are, and you know, you've done amazing things because of it too. So I'm happy with our decision and what we've done. And I wish she would come down, because she's amazing. But
Yeah, she sounds like an incredible girl. And thank you so much for sharing, Franny. And, you know, the thing that I love is how different all 3 of these stories have been. Like, you know, I think it just really speaks to the fact that, you know, there is no one way to go about this. And it's so dependent on, you know, a family and just what feels right and when. And, you know, people, as you mentioned, Freddie, I have known that I was a carrier since around 7 or 8 years old. And people, you know, will ask me like, oh, when should I tell my daughter? And, you know, there's not an answer for that, because you can't say, oh, you should tell them at this age and at this time and in this way. It's different for everyone. And I think it's important that we all know and understand that. But thank you all so much. I know I've heard all of your stories before, but I just love hearing them again. So now we'll move into hearing more about the psychological perspective from our expert, Dr. Susan Weisbrand. And she has some slides prepared, and she's going to discuss you know, the things to consider when a mother is preparing to have this discussion with her daughter. So let me share my screen.
Well, first, I want to thank you for inviting me to this, and thank you for allowing me to hear these amazing stories. And actually, you talked about so many of the things that I was thinking about and read about in preparing this talk. You can go to the next slide. So let me introduce myself first. Susan Waisbrun, and I was or still am the psychologist for the genetics and metabolism clinics at Boston Children's Hospital. And I worked in the clinic there for 40 years. And recently, well, about 2 years ago, retired from clinical work, but I continue to do research, mentoring, and consulting activities. Also professor of pediatrics in the Division of Genetics and Genomics at Harvard Medical School. Plus, I have lots of grandchildren. I like to garden. I still run marathons, and I like to quilt. So I keep a busy life and enjoy talking about these kinds of things as part of the legacy of having had that experience of working in a genetics clinic for 40 years. Next slide. So today I'll talk about the psychological issues to consider when answering the question, how and when to tell my daughter she's a carrier of an X-linked disease. Next slide. And this is important because, as you've said, there is no right answer that fits for everyone. And the psychological issues may be different for a parent than they are for a daughter. So it's really important to keep that separate. And finally, a psychological perspective will prepare you for the conversations, I'd like to say, not just one conversation, and also for what happens afterwards. Next slide. So the key points that I hope you'll remember today is that it's important to understand yourself. What are your symptoms and feelings about being a carrier? And then it's important to understand your daughter's developmental abilities and concerns. And finally, the knowledge of being a carrier probably changes her, but it doesn't have to be a change for the worse. And I think we've heard that a little bit today. So the quick answer is tell your daughter as early as you can and in an age-appropriate manner. But that is predicated on a healthy psychological context. So first, we need to think about you. If you are comfortable with yourself, with discussing this issue and dealing with your daughter's feelings afterwards, you will have successfully managed this topic. Next slide. So acknowledge your symptoms. So here's a list of symptoms that often come with carrier status for urea cycle disorders, but I believe they're similar in other genetic disorders as well. So there's the physical symptoms of feeling tired, having headaches, stomach upset, diarrhea, vomiting, insomnia, some muscle issues. And then there's cognitive and emotional. And these can be both from some of the physical symptoms, but also from the fact of dealing with what you have to deal with when you're a carrier, and especially if you've had a child who's affected. So there's the confusion, difficulties remembering things, disorientation, irritability, anxiety, and depression. And those last two are really important. They kind of have an impact on behavior in so many ways. Next slide. So also pay attention to your family's experiences. And here's where you need to distinguish your needs from your daughter's needs and concerns. And remember that your child will know, as some of you have talked about, when things aren't going well, or if a parent or sibling has been affected, or has a parent or sibling been hospitalized or died. And this does have profound effects on a family, including sometimes PTSD, which is a post-traumatic stress disorder. So these are traumatic events that can alter a family. And the challenge is to understand that, acknowledge it, and then to be able to deal with it. So another question is, how open has your family been about the genetic condition? So that's really important also to know before you start the conversations. Next slide. And realize that your moods and behavior have not gone unnoticed. And some of you have mentioned that even really little kids, 2.5, 3-year-old, they don't miss much. They may not be able to articulate it. And depending on their developmental level, they will interpret those moods and behaviors often as caused by themselves, and won't really attribute it to maybe other stresses in the family. Next slide. I'm a big proponent of counseling, not just because I'm a psychologist, but even if you are coping well, the issue of a genetic condition is psychologically difficult. Having a place and time for talking about the issues and allowing yourself to feel is really helpful. And having a chance to focus on yourself, even if only once a month, is actually a healthy thing to do. It doesn't mean that there's something wrong with you or that you're psychologically in trouble, But this allows you to put the issues on the shelf as you go about your days. That's the way I like to think about it, because there's a lot of demands on you, especially if you have young children or you have actually any age child or relationships. There's other demands. And so you can't be worrying about these issues 100% of the time. They're always there, but if you can put them on the shelf a little bit, that helps. And with the knowledge that every now and then they'll come out and bite you in the tushy, even if you're not expecting it. Next slide, please. So this is the second part of taking a developmental perspective. So at what age do children incorporate information, and how do they incorporate it? And here I'm going to talk a little bit about the Piagetian stages of cognitive development, but also a little bit about the Ericksonian stages of psychosocial development. Next slide. So they call the 2 to 7 years the pre-operational stage. And this is when young children may perceive a blood test as a punishment. They're very egocentric, thinking, I caused this stress, or mommy's crying because I was a naughty girl, or even if I'm a good girl, nobody's happy in here because they don't like me. You know, the kids will come up with anything because it all relates to them. They're probably too young to take in much information about a genetic condition unless unless they're pretty precocious about that. But they hear it. And I always talk about that as money in the bank. If they hear the word gene from the time they're 2, by the time they're 7 or 8, it'll make sense to them. So it isn't all new. So it's okay to try it, but just know that it's not going to be understood completely. And that they will notice and hear stress. And the way to reassure young children isn't to be doubly kind to them, more so than you ordinarily would be, or to relax discipline or to be overindulgent. Reassurance for children is by sticking to a routine, keeping to the rules. And often for young children, their biggest concern when something is going wrong in the house is, am I going to get enough to eat? I know that sounds crazy, but that's really what they're concerned about. That's the most important aspect of their day in some ways. Next slide. So 7 to 11 years is considered concrete operations. And at this age, kids really don't understand causes of death or illness. That doesn't make much sense. And again, they might just think it happens. And if there are secrets in the house, they'll imagine the worst. They have a big imagination. This is when their language improves enough that they can create their own stories. And so it's very important that if you decide not to tell the child about something, that it doesn't come out as a secret in the family. And this is also considered the latency stage in the Ericksonian sense. And children this age, they're busy and working on feeling competent. So if you do talk to them about it, they might not react too much to the information if it's straightforward. They may say, okay, and then, oh, look at this drawing I'm doing, or I want to read this book, or I want to be good at baseball. So that's the kind of thing that may concern them most. That's their concern. Whereas your concern may be, I really want them to understand this, what's going on in our family. And they probably take it in, but that's not where they are. Next slide. So this is the stage at 12 years and over. And that's when what we talk about is executive functioning starts to come into play, which means being able to hold more than one thought at the same time. They are able to think about things in a more abstract way. They don't have to rely on experience alone. They may be logical and work on problem solving. They're able to do that as opposed to having to experience everything that they hear about. Next slide. And here they can understand that a gene is passed down, but many of them won't understand patterns of inheritance or carrier status until mid to late teens. And actually, many adults don't quite understand this either. The number of times that they're shown that chart with the 2 parents and what's a recessive and what's an X-linked, a lot of parents don't understand that either. I'm sure you all do, and people involved, in your group probably do. But that is a complex thing to understand. And also, especially in the teenage and young adult years, this is a time when young people have so many other tasks to worry about. first they have to seek freedom from their parent figures. So it's a little complicated when you have a parent and then the daughter is also a carrier. So that brings a very close bond. And the daughter sometimes feels guilty by separating from mom. On the other hand, if the daughter doesn't carry it, it's like, well, I'm not so much like my mom. So what, who am I? So that's a big question to bring up those conversations. And the way to do it that I would do it in counseling is, in what ways are you like your mom? In what ways are you different? And let them articulate that and support that in both ways. Also, establishing an identity apart from their genetics. Now, granted, it's a big part of your families, it's a big part of her life, but it's not everything. And I think when was it, I think it was Michelle talking about, she didn't want her daughter to have to worry about it and to have that shape her. And that's a very real concern and needs to be dealt with. And a good way to do that, I find in my counseling, is it's often to start with, what's your favorite color? What's your favorite food? What's your favorite movie? Being able to, help young people from an early age, and then as they get older, realize that this is who I am. I'm the kind of person who really likes red. And then, why do you like red? And the answer might be because it's fiery and it's a lot of energy. Oh, so you're the kind of person who likes a lot of energy. That kind of thing helps young people form an identity that isn't really based on an illness or a gene. It's also a time, keep where we were, back. Okay. No. You moved way ahead. Go back. Go back. Now go forward 1 or 2. Where were we? Here. Okay. Handling sexual energies. Okay. So that's a little more fraught when you have a daughter who's a carrier and you don't want the feeling of, well, if I get pregnant, I'll marry the guy or I'll have the kid or whatever. It's a lot more complicated. So those are important conversations to have at that period. And to understand that that may be a mom concern and not so much a kid concern. So you have to think about that. It's also a time when teenagers and young adults might have concerns about being unworthy or inferior. And so it's important to point out their strengths and what they're good at and find areas in which they can excel. So I always tell families, if you have a child who might have some learning issues or might not be good at sports, go the other direction. Try for music, try for art. Keep working till you get something that they can feel good about. Of course, then there's the peer reactions. Do I tell my friends? Do I not? And here's where modeling pays off. If you as a parent have modeled being open about this, your child will be open about this. If you as a parent have felt like, well, I'm open about it with certain people, but not other people, then that's how they're going to do it. And there's no right or wrong. It kind of depends on the situation for that. Next slide. All right, so what now? So we've kind of gone over the developmental stages and what you might be able to expect from children. And here's where I looked into a little bit of the research to see what were young adults saying who had gone through this process, and what have some of the studies shown. Next slide. So most of the studies that interviewed young adults showed that the younger or around 8 years old was about a good time to start talking about this. Those who were told later often wished that they had been told sooner because they knew something was up and they weren't sure what it was. Those who had no clue or the family didn't have to deal with this till later, then that wasn't an issue. But if it is, then that seems to be a good idea. And most of the children in the studies that I looked at knew something was up by age 8 and then wished it hadn't been a secret. The adults said they preferred to learn about their genetic condition very gradually throughout childhood. A couple of the people that were interviewed said, yeah, my parents told me, but then we never talked about it again. And I wondered what was the story, but I was afraid to ask because if they didn't want to talk about it, I didn't want to upset them. So, and children really do want to protect their parents. Just remember that. As much as you want to protect them, they want to protect you. And children this age can understand that their family goes to the doctor a lot to make sure everyone stays healthy. And that's a good way to put it to them. Yeah, we all go to the doctor because we want to make sure we stay healthy. And your daughter will understand that she is like her mom and that the boys might have different health issues. That's another thing they can understand. And then just play. So you can find out a lot about kids if you play with them. And one of the things that some of the mothers in the study were reluctant to do was to play with dolls and for the little girls to play house and be mommies, because they weren't sure that their daughters wanted to be mommies or were going to be able to be safely be mommies. And that can have a profound effect on a child, because part of their development is for girls is playing mommy. That's a big part of our identity in many cases. So you don't want that to get in the way. So play. The other thing that happens when you play with your young children is that their issues always come out. As a play therapist, I had to be very patient and understand that often through play, I wouldn't know why it helped, but it did. Somehow, it sort of allowed them to go through the stories. So don't be afraid to do that after those conversations or in between. Next slide. In adolescence and young adulthood, they still preferred to learn the information gradually. And the first reaction for these older kids was shock. And think about your first reactions as mothers, probably was shock. And they're no different. So parents need to be clear that make it clear to their children that they are happy to be asked questions. The children won't ask questions because they don't want to upset you, or the young adults may not. So you may have to anticipate their questions, or be, if you say, I'm sure you've had this experience where you ask a child, well, is there anything else you want to talk about? Or do you have any questions? They'll say no. Now, a good way to get around that is, all right, well, tell me what you understood about what I told you. Or, let me ask you a question, and then ask them a question that would show either how much they understood or maybe how they were feeling. Young people preferred less formal discussions. They said it was much better if they talked while they were gardening or cooking, riding in the car. I know with my daughters running, if we were running, they would reduce their inhibitions about talking. The other thing to remember is that, especially during adolescence, the girls may not want to talk to you until 11 o'clock at night when they can't call their friends anymore and they can't be engaged in all the other things they want to do. So be prepared for that. Another issue is that the parents should encourage the siblings to talk to each other about it. A number of the young adults that were in these research studies said that they never talked to their siblings, and they don't know why they didn't. They just didn't. And it would have been such a big help to them if they had. Another strategy is that you might tell your daughter how you learned you were a carrier and how you felt about that. And again, use your resources, access the genetic counselors, the geneticists, as Jessie said, that was such a big help for her. And again, psychological counselors can be helpful. And again, it's not a sign of being mentally ill or having psychological problems, but basically a sign of having psychological health, that I'm going to get the resources that can help me. Next slide. So the main message to give to the kids is that being a carrier for a disease-causing gene is part of being normal. When you think about that, every cell has 25,000 genes at least, and most people have at least one and maybe two disease-causing genes that they carry. So part of the diversity in the human condition is that we all have these genes. Now in our family, this is what we're dealing with. And that's not to put a happy light on it, but it's just part of life. And this also allows our children and ourselves the opportunity to learn resilience and how to adjust to the very real ups and downs of life. And I think Jessie's comments, and Franny, when you talked about your daughter, and Taylor, certainly for you, as awful as it is to have to deal with this, it also brings with it some opportunities. And as I said in the beginning, it hasn't changed you for the worse. So to remember that and give that message as well. Next slide. So to remember the 3 key points, it's important to understand yourself, your symptoms and feelings about being a carrier and how they may affect your child. And that it's important to understand your daughter's developmental abilities and concerns. The knowledge of being a carrier probably changes someone, but it doesn't have to be a change for the worse. Next slide. So I put in the 2 studies that I found most helpful that talked about some of the issues and about the experiences of other people. These were primarily cystic fibrosis, and so it wasn't so much X-linked, but I think it was very relevant to some of the issues that were talked about today. Next slide. Thank you, and I've put on my email address if anybody would like to ask me some questions or things come up. Thank you.
That was extremely informative and so interesting, Dr. Weisbrand. And I love how you took us through, all the different stages of a child and young woman's life. And in my experience, and I've told you about this, but my mom, every couple of years, she would re-explain the carrier status to me in a way that was like age appropriate. And I actually invited her to be on this event today.
Yeah.
She's not like a big public speaker, but she's like, kind of like, I don't really know how I, did it. And she's like, I just kind of had to, and in my case with our speakers here, their daughters had a 50% chance of the gene, but since I got it from my father, we knew from my father's diagnosis that I was a carrier. So I think mine was a little different. It's I didn't have to go through the testing process to find out my status. But yeah, my mom's like, I don't know. I just kind of had to figure it out as we went along and see what fit best. But yeah, I think all this information was incredibly valuable and really speaks to what I said about there's no one size fits all, but there's definitely things that, mothers can consider at every stage, to make this discussion and to make their decisions the most appropriate for their daughter and their family. Great. Well, let me stop the screen share. I don't believe we have had any questions sent in. Let me look on Facebook, but I do have a question for our carrier speakers. I know Jesse has to hop off in a couple of minutes, but I was just going to ask you each, like, your piece of advice for women in our group who say haven't yet had this discussion with their daughter. Like, what's something that you wish that someone had told you beforehand? Whoever wants to start.
I think 14 years ago, our disease was quite different because time was different. It was hard to find the community. I think what's wonderful now is our community is very easily found for these new families. So I would say reach out and find your people and see what they're doing and befriend them, and their kids might get to know each other. And that's my advice.
Totally agree.
I know I was gonna, just to piggyback kind of, on what Jesse said, don't be afraid to ask someone else who's gone before you, how they did it, how they talked about it, because you don't have to do it, on your own. I've now talked to other mothers with young girls, and I'm so happy that I can, be that resource for someone. And so it's just, I think that the kind of that vulnerability, being open about, if you can be open about your story, do so, because it always ends up in a strong connection with someone else, and just a positive. It's always a positive.
Definitely.
A takeaway. There are always positive silver linings to all of these diseases.
So very similar to both Jesse and Franny. It was the reason why I started the ARSCOG Foundation, because I wanted to find mums just like me. And at the time, I just felt so lonely when my son was diagnosed, or even the journey to diagnosis. So one of the things in our Facebook groups or the other groups that we have, that I say to all the parents is, be open, be as open as you possibly can. Don't ever be afraid to bare your heart, even when it's painful. One of the things I didn't tell you is that the 3 brothers that I had that had ARSCOG, they all passed away in a 6-month window. And during that period of time, it was the group, it was the other mothers that helped me get through that period by just, I was advocating like crazy for Global Genes or with Taylor or for my own group, you know, and I think making myself vulnerable was one of the most easiest things to do, actually, because I was being myself, I was being honest. And so I say to all the young carriers, all the young women in our foundation, reach out, find us, ask us. I don't care if it's 2 o'clock in the morning. If you need me, phone me. I'll be there for you. And if I can't be there for you, I'll know someone who can. You know, there's always somebody out there who will help you. I mean, this work that we're all doing across the world is phenomenal. When you think about my generation, you know, I was born in 72, there was no talking. My mum was an old Irish lady. She just didn't share. She never told me. She didn't share any of it. So for me, I wanted that to be very different for my daughter and for all the young women in the foundation, and Remember the Girls and everybody. So, you know, I say this when I meet people for the first time: if you need me, here's my number, here's my email, reach out. If I can't help you, I know someone who can.
Oh, I love that. I think that's such a perfect way to close this webinar, and it makes me as a young carrier just feel so lucky for all of you, and you know that I know that I have a community of literally hundreds of women that I can turn to, and that, you know, I can watch what their experiences are like and learn from them. So I appreciate all of you so much for being here. I will be sending all of you a Remember the Girls gift package. And we're getting some nice comments in here. I know Jesse has to hop off, but I want to thank you all. I'll let you know when the recording is available, but I really enjoyed this, and I know our attendees did as well, and that this will be a great resource for carers in the future.
Thank you.
All right.
Thank you so much.
Yeah, this was amazing. Okay. Goodbye, everyone.
Nice
Have a
to
good rest of
meet
your
you, Susan.
Saturday.
Thank you.
Nice to meet you
Bye.
too.
All right, thank you.
All right, God bless.
Bye-bye.
Bye, everyone.